Well, this is a side effect of the incredible medical progress we've had in the course of my lifetime. There are so many more things we can do now, but it takes so many more people to do it. And there are just lots of people involved, and a lot of times it's chaotic for patients. I feel that today patients have three fears. When I was coming out of my training, they were afraid of their diseases and they were afraid of their treatments. But the third fear, which is relatively new, is they are afraid that we don't have our act together, that we're not talking to each other, and that they might be hurt or they might miss out on something because of miscommunication or incomplete communication. So even when the care is coordinated, the patients aren't sure it's coordinated and they have a little bit of panic about that. The worst part's when they don't even ask, but they're wondering, has Dr. So-and-so spoken to Dr. So-and-so? What you can really see is that when you tell them that you're coordinating your care, that you have spoken to each other, the relief that they feel is palpable. You know, they feel that we're actually working together as a team. That peace of mind, that is one of the things we're supposed to be delivering in healthcare. Well, you know, when you think about what is the goal of healthcare, you know, we can't deliver immortality. We can't deliver health to many people. But what we're supposed to be delivering is peace of mind that things are as good as they can be given the cards that they have been dealt. And so working toward giving that peace of mind, knowing that that's the product, asking, are we organized to deliver it? Are we doing things that might actually destroy peace of mind? That's something that every group of providers who wants to work together for their patients should be considering. Systems have a huge role. They have to be the organizing agency for the teamwork that patients are really hoping for. So the information systems is an obvious thing, but actually trying to co-locate clinicians who are likely to be working together, create team structures, and give rewards for better care and more efficient care. The system has to play the lead role on that. But beyond that, I think that there's creating a value that empathic care is a norm. It shouldn't be the subject of financial incentives. It should be a social norm. Physicians shouldn't be making a calculation of, well, should I be nice or should I see 3 more patients? It should be an issue of, can I look at myself in the mirror? What will my colleagues think if I'm not providing empathic, coordinated care? And systems can set the tone and they can spread the norm. Yeah. Oh, I think that it takes some thoughtful planning and a multidimensional approach. You know, part of it's stories. You need to tell stories of when care was the way we wanted, and also tell stories when care was not the way we wanted it, so that pride and shame can come into play. But then you need accountability and measurement, and so asking patients about the care delivered by various clinicians, and then trying to create some kind of structure where physicians feel the question isn't, am I good enough? Did I pass the test? The real question is, how can I get better than I currently am? And they feel constantly interested in how they might get better. You know, one of the major themes of our time, I think, is transparency, where organizations are taking all their patient comments, measuring it on every patient, and putting all the comments right up on the internet. And I don't think anything leads to as much interest in improvement as the transparency that comes from being measured and having it on the web. What I enjoy is learning from my colleagues around me, in my own organization and colleagues in other organizations. And there are terrific things to imitate, you know, out there. And there are things that happen where you just suddenly realize, I've been missing out. I didn't have the right goal in mind. So one thing that recently struck me, you know, I was just visiting with some home care providers, and it suddenly hit me that getting home is an outcome. people want to be home. You know, they get in their doors and they just feel so much better than they felt wherever they were before. And whatever we can do to get them home, that's worth a lot more than a lot of the medications I'm prescribing and the tests that I'm ordering. So recognizing what's the real goal, what are the real goals, because there are many of them, but there are goals like getting home, getting patients home, measuring it, and organizing to maximize it, and constantly be thinking, how can we do better? That's what's really exciting about where healthcare is going right now.